Welcome to the Biohackers live show. My name is Teemu Arina, and I'm your host today. Today, we will dive deep into regenerative medicine together with Dr. Kristin Komela. She's one of the top experts on this field, has a bunch of publications on stem cells and regenerative medicine, and she has a lot of experience through US stem cell clinic as well as through her own research into the potential of using your own body to heal itself. Before we start, I want to remind you of your abilities to join into this conversation. So you can use the hashtag #BiohackersLive, hashtag #BiohackersLive. You can use it on Twitter and Instagram. I'll be following any of the updates coming in. If you have any questions, throw in. Also, you can follow the stream on our Facebook channels for Biohackers Handbook as well as Biohackers Summit, and also on our YouTube channel. So if you have any questions, post your questions, and we'll pick some of those throughout the show to ask Kristin. And the show notes for this episode and the recording will be available at biohack.to/Kristin. So with that, Dr. Kristin Komela, I'll give you a little background on her. So she's a PhD and a world-renowned expert on regenerative medicine with a focus on adipose-derived stem cells. And she has a PhD in cell science and holds both MS and BS in chemical engineering. Her professional experience includes positions in several companies, including recently US Stem Cell, Vet Biologics, Tulane University, and Osiris Therapeutics. She's currently serving as the Chief Science Officer and board member of US Stem Cell, a publicly traded company in the US side, focusing on discovery, development, and commercialization of autologous cell therapies for the treatment of degenerative diseases. And she has certainly been very active on this field, being responsible for development and implementation of cell therapies in the clinic for a wide variety of different indicators for more than 7,000 patients. Furthermore, hundreds of practitioners worldwide have provided stem cell treatments to their patients using her protocols. So I'm going to invite her in just in a second. So let's take a look at the trailer. Hey, Kristin, how are you doing?
Hi, great.
Awesome to have you finally in this show. So how did you start your day? What time is it over there?
It's just past 10 a.m. I'm still fasting, so helping to boost my stem cells naturally with a little intermittent fasting. And oftentimes I'll start my morning with a Ben Greenfield type smoothie, which includes avocado and spinach.
So the kick-ass monster smoothie that he makes
Yes.
that has like everything in it.
Yeah.
I see. What I'm drinking here is the longevity tea called Gynostema, together with some puer tea. So I'm also trying to extend my telomeres. I don't know if that's going to work, but at least I really do enjoy the taste of this drink.
Being optimistic and hopeful about it is half the battle. Keeps your telomeres longer.
That's for sure. So going into the topic of today, so how did you get interested about stem cells? What's kind of your background into it?
Sure. When I originally started my undergraduate, I was studying chemical engineering, but I took more of a focus applying engineering to the body because really the most amazing machine that's ever been made is the human body. Think about it. Your heart is a fantastic electrical device that will work for 100 years without fail. There's no electronic on the planet that will work this fantastic. And so by applying engineering ideas to the human body, I think that we can really help to improve the quality of our life and also increase our lifespan. So looking at some of the things that occur naturally inside our body and then seeing how we can tap into it has really been the focus of my career. The most amazing thing inside our body is stem cells. And so learning how to hack the stem cells in our body and apply them where we need them most uh, is going to be critical to longevity.
That's for sure. It's going to be critical. And my question to you is like, have you always been interested in longevity, like taking care of yourself also in other ways than fixing yourself when things start to break?
I have. I've always been a bit of a health nut, as well as, I guess, a gym rat. So I do like to exercise and find ways to improve my health in most natural ways. And of course, I do consider myself a biohacker. So ways to really enhance health and look at myself from the inside out, both mentally and physically.
What is I mean, if you give like a short pitch to anyone, like what stem cells are, and how we can benefit from them, and what's their role in the body, like what's your kind of elevator speech on it?
Sure, sure. So every single one of us has stem cells inside our body. The main purpose of these cells is to maintain and heal tissue where they reside. So if you went to the gym this morning and you did a few squats, you would get little tears inside your muscle. And the main purpose of the stem cells that lay beneath the muscle is to come out and repair those tears. So this is why if you went to the gym every single day doing squats, your muscles would eventually get bigger. It's because your stem cells are helping to repair and to create new muscle. This goes on inside every single tissue inside our body. We're having constant turnover, and it's the stem cells that are responsible for this. In fact, if you didn't have stem cells in your body, you could only live for about an hour. And one thing that I think I see oftentimes misquoted is that as we age, our stem cells are not as good, or maybe we don't have as many. Regardless of your age, you have stem cells hard at work. So if you're still alive and breathing, you've got stem cells. So all we need to do is harness this healing potential that naturally exists inside you and that is responsible for repairing. The challenge is that sometimes as we age, our stem cells become overworked and burdened, and we're not able to repair injuries or exhausted tissues as easily. So, this is why we want to assist the body by taking stem cells where they may lie in storage and relocating them to where we most need them.
I gotcha. So when it comes to the role of stem cells in regenerating tissues, I mean, what separates us from certain animals that can, for example, grow a new tail?
Yeah, so a lot of this has to actually do with electrical stimulation. This is something that we've worked at on in our lab, combining electrical stimulation with the concept of stem cells. And so, if we can figure out the exact correct electrical stimulation to apply while we are applying stem cells, we may actually be able to stimulate growth of a new limb. For example, if somebody has a finger that's been cut off, we could potentially grow this back. And we've actually done a couple patients where we've applied the stem cells after having lost a limb, and we've gained several millimeters, if not centimeters, on that limb that was lost. So we did some experiments in the lab where we took stem cells and grew them in a petri dish, and we applied electrical stimulation similar to a heartbeat while those cells were growing. And what we discovered is that we could actually double the cardiac proteins expressed just by applying this electrical stim in combination, with the stem cells that were growing. So I do think that's going to be something that we'll see in the future, where we can grow limbs and/or organs. Time will tell how long that will take. But for now, what we've been doing is applying the stem cells to injuries and helping to repair and restore damaged tissue. So,
Hmm.
one of the easiest ways to collect stem cells is actually from your fat tissue.
And that's what you focus on. So when it comes to stem cell therapies, what are the therapies today that are clinically most promising and most used?
So, about 10 or so years ago, I began working with stem cells from the fat tissue. Prior to that, I had looked at other sources of stem cells, including bone marrow and muscle, which, by the way, every single tissue inside our body has stem cells. So, you could isolate stem cells from just about any tissue source inside the body. what we discovered is that one of the most plentiful sources of stem cells is our fat tissue. And it's a very easy procedure to obtain fat tissue. It's so easy that we are able to do it with just local anesthesia. Patients can remain awake. We make such a tiny incision that it doesn't even require stitching. And we put some numbing solution just below the skin. And from a very small amount of fat, we can get a huge amount of
Hmm.
stem cells. And one of the other reasons that this is really preferred for us is because the amount of white blood cells that are present in the fat tissue is very low. Now, white blood cells are pro inflammatory. This is part of our body's natural healing response. White blood cells create that inflammation. So, oftentimes, our
Hmm.
bodies overreact with inflammation. And so, when we're trying to address something that is damaged or damaged tissue as a result of a disease, we don't necessarily want additional inflammation. So, using a tissue source that's going to be low in white blood cells but very high in stem cells is ideal, and fat tissue is that. The other thing that's really great about the fat tissue is that it tends to be a protected source, meaning that our fat doesn't age at the same rate as other areas in our body. So, for example, the stem cells that are present in our bone marrow go down as we age, whereas the amount of stem cells present in our fat tissue tend to stay very even as we age. So, you can still get a very good amount of cells even from patients that are in their 90s. And once we take those cells out, we can use it to apply many different indications. So currently, we're working with patients who have neurological conditions, issues inside their brain. This could include things like Parkinson's or MS, or even traumatic brain injury. We also work with patients that have systemic issues, whether they're autoimmune diseases or different degenerative diseases, issues in the heart, lungs, diabetes. And we do quite a bit of orthopedics. So
Hmm.
these can be injuries and or degenerative conditions like osteoarthritis. We also work with issues inside the back, things like degenerative disc disease or injured back. And then the last thing that we do is going to be more like an anti-aging. This is certainly something that I do on myself, where I apply the stem cells when I don't necessarily have anything wrong, but I can apply them systemically, and the cells will naturally home to areas of inflammation, and they can help to reduce that inflammation. And as many of us know, inflammation is really what kills us. It's what causes our telomeres to shorten, and it essentially determines our age. So by keeping down inflammation, and you can do this in a variety of different ways, but
Hmm.
one of the things that I do is apply a stem cell dose to myself about every 6 to 12 months.
Oh, you do? So you're basically injecting yourself with stem cells to bring down inflammation. So that seems like a preventive measure.
That's correct. So one of the things that
Hmm.
I like to do is if I know that I've been traveling, I'm going to be exposed to a lot of radiation on airplanes, or just kind of hard travel that requires my sleep schedule to get interrupted. This takes a toll on the body, so I'll do an IV dose at that time, just to give me a little boost. So what I often will notice when I do this is I get increased vascular supply. So my fingernails or my hair will grow faster.
Wow.
I see an improvement in my skin quality, and sometimes increased libido.
Oh, uh, most of those that you just mentioned sound like things that I get from collagen, but definitely not better libido. So I need some other things for that. Another question for you about that kind of procedure. So when you look at things like cancer risk, when you look at growth factors, and using something like that, like a growth hormone, how about injecting yourself with stem cells? Is there a risk for cancer increasing?
Yes. So, certainly there's probably a lot more research that needs to be done before we can say with certainty what exactly the risks are going to be. And any medical procedure does come with risks. That being said, we began treating patients in 2001. We've done more than 10,000 cases. We've demonstrated in a peer reviewed journal that this is a safe procedure. And we can very easily take those cells out and put them back in. These are your own cells, so we're not using foreign substance. And because they are adult stem cells, they have something called growth inhibition. So when they cover an area, they automatically downregulate replication and they begin signaling for differentiation to repair tissue. So this kind of overgrowth that you hear sometimes talked about with stem cells has to do with embryonic stem cells and not adult stem cells. The other thing to keep in mind is we've actually been treating cancer patients with a stem cell therapy since the 1930s, and this is often called a bone marrow transplant, but it is in fact a stem cell treatment. So there is quite a bit of data already available demonstrating that these cells can safely be used in cancer patients and or without risk of creating a cancer issue or a tumor.
Okay. I guess like when it comes to these kind of treatments, there is moments in your life when a lot of other kind of therapies are not going to produce the results. So relying on your stem cells might give a significant boost. And for that, I want to bring up a case of Mel Gibson and his father. So let's check a little video from Seam Land about the interview with Mel Gibson on the Joe Rogan podcast, and that was pretty interesting. Let's check it out.
So this, you wanted to come in and talk about stem cells.
Yeah.
Maybe you heard recently about how Mel Gibson took his dad to stem cell therapy.
Initially, it was for my dad. He was 92, and he was doing all the old man stuff. You know, his hip was killing him, and he was like, he had multiple problems.
Hutton Gibson, who was 92 at the time, had many health and joint issues.
Everything from, you know, the prostate to the hip, to the kidneys, to the heart, to the lung, you know, the whole deal.
Before the treatment, the old man was in pretty bad shape in a wheelchair, but he was injected with some intravenous stem cells that put young anti-inflammatory cytokines and growth factors into his body.
We took him down there, and he got, I think it was like a double dose in the hip.
A double dose in the hip.
He's almost 100 years old. And from pretty bad shape, it was like bee stings. It was like he got a new lease of life. His cognitive powers improved. His eyesight improved.
Whoa.
Whoa.
You know, and other stuff improved that he would hate me to talk about.
A double dose in the hip.
Intravenous stem cells.
Whoa.
But he had two nurses that reported to me. And it was like, holy mackerel.
Dr. Neil Riordan, the one who carried out the procedure, claims that the stem cells will also heal spinal cord injury, as they've helped to make a paralyzed pilot who crashed in a plane walk again. Mel Gibson was also seen together with the famous social media star Dan Bilzerian at the Stem Cell Institute in Panama.
I did the rotator cuff. I basically couldn't even lift my arm like 3 inches. I did the Regenicon, and then 3 weeks later I was boxing.
What is this magical sorcery? Or is it the Illuminati technology? Stem cell therapy is definitely not something new, but it's still not very common in mainstream medicine. And of course, it's quite expensive as well, so most people can't afford it. But don't worry, you too can rejuvenate yourself and regain your youthfulness.
Double dose in the hip.
Oh, that's cool. Thank you very much, Seam. And we're going to bring Seam online. So if Seam's around, let us know.
Hello, I'm here.
Okay, cool, Seam. So you basically are someone who is taking an approach that is, someone could say, a natural approach to basically influencing your stem cells through diet, and you're doing ketogenic diet. Kristen Comella mentioned that she's been fasting to boost her stem cells. So what's your take on this? Like, I mean, you've been looking into the issue.
Well, yeah, like we mentioned in our last night's live stream, like that these kinds of biotech and biohacking, these kinds of things, they're going to be more accessible to people who can afford it. And, you know, the stem cells, they're a prime example of this. And you know, Dan Bilzerian, Mel Gibson, they get access to these kinds of anti-aging technologies. So like for the average people, what they can do instead is until like in the future, it's definitely going to be something that everyone can get access to and everyone should, you know, take advantage of. But in the meanwhile, while we're developing these technologies, then everyone can do something simple strategies that every day they can do it, and which can, allow their body to mobilize the stem cells that they already produce naturally. So one of the best things that I can think of is like fasting, like Kristen mentioned already, and that's shown to have like many other rejuvenating effects, anti-aging benefits, improvement in all biomarkers, and it's going to burn fat and all those good stuff. So
and immune
fasting
system
is definitely fasting is my go-to.
Yeah, regenerating the immune system and all these things, and just like on the video, holy macro, better libido. So Kristen, what's your take on someone like Mel Gibson and his dad kind of getting these kind of injections and noticing and almost like a miracle recovery in the last phase of his age?
Yeah, so one of the first things that we notice for a patient who is very inflamed, when we do a stem cell injection, they will oftentimes feel a response right away because the stem cells can break that inflammatory cycle. So inflammation tends to create more inflammation, and this is a fantastic way to stop that cycle. New tissue formation can take months, so that will begin around the 3 to 6 month time period. So think about a lizard, like we mentioned before, that grows back its tail. That takes about 2 years to grow back a simple tail. So growing new tissue after there's been a significant amount of damage can take a little bit of time and may require repeat dosing with the stem cells. So it may not be a one and done type thing. In fact, I think that's a little bit unrealistic expectation that was placed on the field. The other thing is, over the years, we have been able to bring down the cost of these treatments by bringing them into the United States. So when we first began doing some of these therapies, we were doing it outside the country, and the costs could be in the tens of thousands of dollars. But now, because we're able to do this with practitioners here in the United States, the costs have come down quite a bit, and they start in that $5,000 range, which is very reasonable, especially when you consider we offer financing programs. And you can even get things like platelet-rich plasma, which are a variety of different growth factors that are present inside your blood. And these start in the $500 range. So what used to be only for extremely wealthy individuals is now becoming something that's applicable for all Americans and individuals throughout the world. So I think that there's nothing more valuable than your health. So spending a few $1,000s to ensure that the quality of your life for a long period of time is well worth it.
Definitely. So when it comes to these kind of injections, and if the cost is like a 5K, I would imagine you save that much in potential medical costs that might be for pain management or that might be for hospital visits. So if you are able to take a treatment that costs only 5K, that's probably going to be actually an investment into yourself that's going to save you later down the road.
Yeah, absolutely. And when you think about the downtime associated with surgeries or lost time as a result of your injury and or disease, lost time at work, this is an outpatient procedure. It's about 2 to 3 hours in clinic, and patients can resume their normal activities. Our main limitations after the procedure is that we ask that you don't submerge in water for about 1 week. You can take your normal showers. We ask that you don't drink alcohol or smoke cigarettes for a week. We also ask that you don't smoke cigarettes ever, because this will certainly age you, and to limit your alcohol consumption, because alcohol kills stem cells. So, and this is one of the reasons you notice people who are heavy drinkers tend to look much older. It's because their stem cells are being killed, so they're not replenishing their tissues, so their skin starts to look aged and diseased.
Ooh, Seam, I mean, what would you kind of go for? Would you take a stem cell therapy if that means that you will be able to extend your lifespan, maybe reduce kind of any kind of inflammatory or chronic disease or reduce the symptoms, and at the same time, go a few weeks without cold showers?
Well, I think that
You can take a shower, just no bathtub.
Right. Well, yeah, but I think like that of course if the situation requires it, then I'll do anything that's going to improve my well-being and health. But I also like to think that prevention is the best cure, in the sense that you have to be actively doing these kinds of anti-aging activities and habits that are going to maintain your stem cells and prevent them from prevent these kinds of injuries from happening as well. Like making sure your diet is on point, keeping your gut healthy, maintaining muscle mass as you age, mobility exercises, those kinds of things, they're all important. And prevention is the best cure, in my opinion.
Absolutely. I was just checking like a video by Peter Attia on these kind of longevity related things, and he's talking a lot about the importance of muscle mass that is often forgotten when it comes to calorie restricted diets and so on. You're definitely going to need that also later in life. And
and they actually studies have shown that people who are stronger actually live longer. So like grip strength is a huge indicator of longevity, and I think that because it shows that you're staying active, and it's all correlated to that.
Absolutely. Thank you very much, Siim. So I'm going to continue with Kristen. So we're going to jump into some research of these kind of therapies. Personally, the situation where I am is that I have one chronic pain and chronic injury situation that I'm dealing with, which is some spinal injury that I got from doing pull-ups, and not from doing pull-ups, but really dropping from a pull-up bar down to the ground a little bit a couple of years ago, and it's a lingering pain still, on my upper back. And I haven't got an MRI, but probably there is something going on there with the discs that could potentially cause issues down the road. So I've been kind of considering how to deal with that. I've been able to keep the inflammation down. I've been doing the lab tests. I'm able to deal with some of the pain issues. I was just in London. I was doing a TEDx talk there, and I visited this hyperbaric oxygen chamber. So basically, you go to a few bars. What happens is that the oxygen molecules, you're breathing pure oxygen. The oxygen molecules get really, really small in your bloodstream, just like when you are going diving. And it enables that oxygen to enter tissues that don't necessarily get as much oxygen in a normal state. And you're there for like 60 to 90 minutes. And when I came out of that chamber, I have to say that I was pain-free for a few days, and I felt amazing. And certainly the level of pain has reduced since that procedure. So, but I've been thinking, what if I go and do stem cell injection into my spine and see what happens with that kind of thing, or if I should wait a little bit that I get to the age of Mel Gibson or his father to kind of do these things to enjoy my later years more so. So let's take the weekly research article that's kind of diving into this very topic. I'm going to run a little video here, and then we're going to jump into it. Okay, cool. The research article of the week is published in 2014 in the Stem Cells Journal with the title Percutaneous Injection of Autologous Bone Marrow Concentrate Cells Significantly Reduces Lumbar Discogenic Pain Through 12 Months. Wow, that was a mouthful of medical jargon. So what this basically means is that back pain affects millions of people and result in billions of dollars in lost income and medical expenses annually. And degenerative changes in lumbar disc are so ubiquitous that they are considered a normal aging process. I mean, that's what a lot of people are dealing with. That's what a lot of our relatives are dealing with, this disc issues. So degenerative disc disease induces chronic pain with limited non-surgical options. I mean, there is some treatments you can deal with, but it's kind of limited. Recently, a regenerative medicine approach to the repair of damaged and chronically inflamed tissues has been sought as an alternative to invasive surgery or pharmaceuticals. And that's what the study went down into. So if we look here, there was 26 patients. There was no placebo control. And they were selected with the following criteria. They had centralized chronic low back pain that increased with activity and lasted at least 6 months. All of those patients underwent pre-injection medical injection, medical history, and different kind of physical examination. All other patients were injected based on MRI scans, and MRI scans were repeated at 12 months. So what we see here on the image number, the letter A, is basically a typical picture before, and the image B is after 12 months. And in looking at the results, there was statistically significant reduction in different pain indicator scores, and it looked pretty good. Only 5 patients did not improve, so out of 26 patients, by at least 25% in terms of their pain. So most of the people really got help from this kind of injection. Rehydration of the discs happened in 8 of 20 patients, according to MRI, and in conjunction with sustained pain relief through 12 months. That's statistically significant. That's very interesting. There were no reported adverse effects, and in the aspiration site or in the injection site for any of those patients. So it seems like a pretty safe thing. So can you, Kristin, kind of guide us through like how much of these kind of treatments are being done, how experimental these kind of treatments are, and where we're going to see that this field is going to be going in the future?
Yeah, so I think that this is actually going to be very common for back patients and for back pain and for injuries and degeneration in the spine. I think that we are all very aware of the opiate epidemic, and practitioners as well as patients are looking for alternatives that are, instead of masking the symptoms, getting to the root cause. And regenerative medicine is so primed to take over in this space. We actually have published a very similar study about a year ago in degenerative disc patients, where instead of using the bone marrow aspirate, we were using the stem cells from the fat tissue. And because this is going to be higher in stem cells, we think that we can get better outcomes for these patients. We demonstrated statistically significant improvements in their range of motion, reduction of pain, and overall improvement in quality of life, which is really the goal. We want patients to feel better, and we want them to be able to do activities that they want to do every single day. And back pain is really debilitating. So I think that you're going to see more and more practitioners moving to these type of therapies and offering it to their patients. So one of the things that we did in our study is we actually did an intradiscal injection, which means that we can put the cells directly into the center of the disc to help with any sort of annular tears or to help improve disc height. The discs are made of cartilage, so what we're trying to do is improve that cartilage space and volume. The other thing that we want to do when we're addressing patients with back pain is look downstream to the discs. So because you're getting an injury in your discs, it means that there's something going on downstream in the surrounding tendons and ligaments. So we can also do injections in that surrounding tissue to help strengthen it. Because if you address the injury in the disc, but you don't address downstream, you're just going to allow for more injuries in the future. So we really have to look at the full picture. Using these treatments in combination with a healthy and biohacked lifestyle is really going to be the key to success for these patients. In other words, if we address the acute injury or the damage that's been created over time, but then we don't help the patient to live a better lifestyle with an anti-inflammatory diet and to detoxify, then they're going to be right back in that same position. So really a full combination approach to health and well-being is critical for a patient with chronic back pain.
So I have your article open here. So there's the figure 3 on average pain ratings. And what can you tell us about the results here?
Yeah, so patients demonstrated statistically significant improvements in their pain scale. So these are patient reported. Essentially, they're saying that they don't have as much pain. They're able to reduce the use of any sort of painkillers that they were previously taking in order to make it through their day. They also showed improvements in their range of motion, meaning that they can do activities that they hadn't done in many years as a result of the debilitating back pain they were experiencing amazing. This was the first ever study using stem cells from the fat tissue for degenerative disc disease. So we were very excited about the outcome, and certainly look forward to doing additional studies in the future.
Right. So if I went, into a treatment like this, what kind of diagnosis would you do, and what would be the intervention all about, and what kind of risks should I prepare for?
So when we're going to be addressing back pain, we of course want to see a recent MRI to understand everything that's going on inside the spine. We also work with a double-boarded pain management and anesthesiologist specialist who will review medical history and go over the MRI and try to determine the most appropriate treatment pathway going forward. We do all of our injections under live X-ray or C-arm, so it's fluoroscopy, which allows us to get the exact correct needle placement and do the injections. The As far as side effects and limitations, of course, anytime you pierce the skin with a needle, there are risks associated with that, including things like infection. But we've demonstrated that these are safe procedures. In that study, we did not have any severe adverse events reported from any of the patients. It was a very tolerable procedure. The site where we remove the fat tissue can sometimes be a little sore. When I had it done, I equate it to feeling like if I had done a really hard ab exercise that I hadn't done in many years, that sore feeling. So if someone were to push on it, it felt like a bruise. But other than that, very tolerable. I was back at a spinning class in 2 days. As far as where we do the injections in the back, you may experience some soreness from the needle pokes. But again, you can resume your normal activities. So significantly less downtime than you would experience from any sort of back surgery.
Right. And where in world is this even possible? Like, I would imagine that here it's only used for cancer patients, for their immune system support and so on. Like, what's going on here in terms of getting these kind of more preventive or kind of treatments that are not necessary for reasons that are life-threatening, but which are dealing with just like improving the way I feel.
Yeah, so we're seeing more and more practitioners worldwide integrating these therapies into their practice. We've trained over 700 practitioners. We currently work with over 280 physicians worldwide who are offering these therapies, and not necessarily for back procedures, but for all indications. We have several clinics within the United States that we work with, as well as some outside the United States. And every single morning I wake up and I look in the mirror and I say, how am I going to get stem cell treatments to as many patients as possible today? So today was to do a podcast with you. I think the more audience that we can reach to let them know that these therapies are available and that there are probably practitioners in their area that are beginning to integrate into their practice.
So there's a question from Lee Evin from Finland. He's actually Australian, here in the chat, that where can you partake in a stem cell therapy if you want to do it in the European Union? Are you aware of any?
So I'm not sure in Finland, but certainly if he wants to send us a note, we could look into that and see if we have any doctors in that area that have come through training. We are usstemcellclinic.com. Feel free to send a note. It's info@usstemcellclinic.com, and we can begin to hook him up with practitioners that would be closest to him.
I see.
If not, come to Florida. That's where I am.
Yeah. Wow. I'm definitely going to be joining you at least for our upcoming conference. So what can you tell about the conference that you're organizing every year?
Yes, so I'm currently serving as the president of the Academy of Regenerative Practices. We have an annual conference every year. Our next one is coming up in March 2019. We just had a conference March 2018, and it is available online for anyone who missed the conference and would like to watch the lectures. We have scientists, physicians, and other biohackers from all over the world come and present about some of their research and help people obtain healing from the inside out. Tap into your natural healing. This is the most valuable thing you've ever been given, is your health. So learn how to make it the best.
we will be there with Dr. Olli Sovijärvi. So I will be focusing more on the technology side of optimizing your health, and Olli is going to be focusing more on the kind of nutritional different interventions that you can do also to support your stem cells and mitochondria and so on. So very excited about that. So check it out if you are in the US and you're planning to get more knowledgeable about regenerative medicine. The lineup looks absolutely stunning. When it comes to different resources, so if people want to learn more about stem cell therapies and dive deeper into it and kind of what it takes, what would you direct people to go for when it comes to websites or podcasts or research journals or just about anything that, like a book, for example?
Sure. So on our usstemcellclinic.com website, we have a lot of resources for interested patients. We have videos. We also have different articles. We break them down and we show easy to understand results, because I think sometimes these articles can be a little overwhelming with high-tech scientific terms. In addition, you can certainly go to PubMed.com. I have several articles available on PubMed describing some of the treatments that we've done. So you can type in my last name to view some of those articles. The internet has quite a bit on stem cell research at this point, and I think it is something that all of us are probably going to get done to us in our lifetime.
Absolutely. So I actually want to throw in the weekly app review. So there's a couple of interesting apps that I found that would be of use if you are into. There is a couple of interesting apps that you can get yourself into if you're interested in human anatomy. So there is the Stem Cells Journals app that basically includes all the news that are going on in stem cells as we speak, aggregated from different sources. So that's something you may want to jump into. You can look at different issues and news that is coming out from some of these main publications. So Kristen, which journals are you following on if you kind of want to look at the leading bleeding edge research on these things?
Yeah, so I don't follow any particular journal. I more follow PubMed, which is pubmed.com, to see what is being published. This way you can see all the journals gathered together. This journal that you're talking about, Stem Cells, tends to be a little bit more basic research as opposed to actual treatments on humans. So more like benchtop research, looking at the different types of cells that might be present in our body, which is fantastic. But then how do we actually apply those to human treatments? For that, like I said, I go to PubMed just to see what groups are publishing different trials and or studies on humans and actual translation into the clinic, which I think is going to be most interesting for the patients. How does this apply to them personally in their health?
Is there any books that you would recommend for people who are interested in kind of getting a basic overview on stem cells?
Yeah, the challenge with a book in stem cells is the field changes so rapidly. So by the time a book is published, it's already become outdated. So there aren't a whole lot of stem cell books that I can recommend at this point. I would say mostly going to the journals.
I see. Okay. So what kind of search keywords would you enter into PubMed to kind of stay up to date with these things?
Probably stem cells in general. And then you could also put stem cells human. That way it shows you which ones are going to be done on humans versus a mice study. But I actually just was at the PaleoFX conference and I talked about this on stage. An interesting study that was coming out of Indiana University where they were working with rodents and they had the rodents smoking cigarettes, and they developed emphysema.
How
And
how,
then
how does
they,
a rodent smoke a cigarette? The
yeah, very
picture in my
tiny,
mind
very
just like
tiny.
very tiny cigarettes
Uh-huh.
enjoying.
Uh-huh.
Yeah. Can they get hooked to it? Like, if you give them a pack
Oh
of
yes, they get
cigarettes, they will
addicted.
they
So they
will keep on
actually
smoking.
put them in cages, and then they blow the smoke into the cage. And when they first start dosing the rodents with cigarettes, they run away from the smoke. They don't like it. But within a short amount of time, they've become addicted, and they actually run to the smoke. Which was a separate study. But anyway, in this study, they were showing that when they would dose these rats with cigarettes, they would develop emphysema. The next thing that they would do is dose them with stem cells from the fat tissue, and they could actually reverse the emphysema. Well, in a second arm of the study, what they did is while they were having the rats smoke, they were dosing them with stem cells the whole time, and they never developed emphysema. So, this concept of using your stem cells in a more protective nature is huge,
That's
preventative.
that is a huge relief to anyone who is smoking out there. You can continue smoking, and you will be able to fix yourself with stem cells, and that
That's
also
right.
includes all the small rodents who are hooked to tobacco.
Yeah.
Um,
And as an interesting side note, I can tell a lot about a person just by looking at their fat tissue that we've just removed. So when the fat tissue comes out, if it's kind of gray tinted, we know that you smoke. That's very obvious. And we find that when we try to isolate your stem cells and grow them, if you are a smoker, they just don't grow as well. Obviously, we don't need extra reasons not to smoke cigarette, but here's another one that it definitely makes your stem cells not as viable. The other thing is we notice that when a person is following a kind of keto and or paleo type diet, their fat is actually very dense and almost sticky, stringy, and we get much higher stem cells per gram of tissue than somebody who is on a very high grain diet. Someone who's on a high grain diet tends to have very fluffy, buttery looking fat, and we do not get as many stem cells per gram of tissue.
Ooh, that's gross. It reminds me of all those pictures of lung tissue of smokers, but I didn't know it's gonna also end up in the fat tissue around the body.
Mhm.
Looking at the body, I mean, if people are interested in anatomy, there is the Essential Anatomy 5 app, which is super cool. Also, um, for example, this app is used in medical school. So if anyone is kind of interested to dive deep into their own bodies and figure out, if you have let's say a spinal injury or something like this, you may want to kind of look at this thing. Let's see if I can kind of dig out the spine here. So this is a pretty cool app on its own, kind of getting yourself. Let's isolate this particular part so you can kind of dive deep into your body and better understand some of these anatomical issues, especially if you have some MRI pictures. That's probably going to be a pretty cool app for anyone who's interested in their body. And I imagine in the future we will have MRI scans that will be turned into apps like this so that you can browse yourself around and you can almost plan your own treatment while you're looking at what's going on there. So that's super interesting what's possible with today's technology. I wish there was an app like this for cell biology. That would be super cool to dive deep into and understand what's going on a cellular level. Are you, Kristin, aware of any apps or websites or anything that kind of helps people to dive deeper into cell biology?
I'm not, but I just added something to my to-do list.
I gotcha. Yeah, this is a really, really cool app. So that's it for the weekly app. So if people want to know more and they want to dive deeper into their own bodies and into their own body's ability to heal, where can they find more information about the work that you do, as well as if they're interested to get a treatment like this or consultation for it?
Yeah, definitely. usstemcellclinic.com. Also, they can follow us on Facebook or any of the other social media. In addition, I have an open Facebook page. They're welcome to come and follow me or chat with me there. It's Kristen with an I, Camella, comma, PhD on Facebook. And I would love to hear from anyone who's interested in stem cells and find out how we can help you tap into your natural healing. I think it's important that everyone take their health into their own hands. No one's going to care more about your health than yourself.
That is definitely a punchline that I also like to use. No one else is going to be a bigger expert than you, so get down to also this type of information if you're into longevity research and kind of figuring out how to live happy and long and pain-free. Stem cells have a huge potential, although they are still a kind of a growing field and it's still early. My understanding is that the FDA in US has not yet classified stem cells as medicine. What do you think about this?
So we're in discussions right now with the FDA to figure out the most appropriate pathway forward. We work with a large firm, law firm in DC to help us navigate these conversations. Our feeling is that the stem cells that exist inside our body are not a drug, and we are going to fight to keep the rights of patients to harness this, as well as practitioners to use this as a tool for their patients.
Good. So with Kristen, we're gonna have her as a keynote at one of those upcoming Biohacker Summit conferences. There's going to be a conference on 18th of May in Stockholm. Kristen's not going to be there, but there's going to be a bunch of interesting people like Serge Faguet, who I interviewed in a previous episode. There's going to be Greg Potter, who is a sleep researcher looking at time-restricted eating. What does it mean if you eat during the night? What does it do to your lipid values and your risk for diabetes and your general health and well-being? So there's many things that you can do while you're still awake, and in terms of systemic interventions into your own biology. And when it comes to our upcoming events, there's going to be an event in Toronto. It's still under planning. It's going to be around November. So a Biohacker Summit is coming up there. We don't know if Kristen's going to be there or in our flagship event that's going to be in 2019 spring in Helsinki, Finland. We're going to be sending out more information on those things. So please follow us on Facebook and on YouTube, and we'll post more information on this, and check out the biohackersummit.com website. So Kristen, with that, awesome to have you here. Looking forward to your talk also in the future. Anyone interested in the Regenerative Medicine Conference on the US side, check out US Stem Cell website and follow Kristen on Twitter and elsewhere. So thank you so much for joining us.
Thank you for having me.